Today we will talk about the practical aspects of this COVID-19 infection, and particularly I will focus on the practical aspect, how we can handle, how we can prevent, and what to do if we are exposed or got the infection. Also important to know if somebody within our family who lives under the same roofs has developed COVID-19 infection. The most important thing to know that coronavirus is a common infection. Almost 30% of the common cold infections are due to coronavirus. So the symptoms and sign could be similar. Another thing is it is very infectious, though it is like the common cold, but it is very infectious, and infections means that it transmits from one person to the other person very easily, more easily than the flu virus, and particularly it is fatal in those who have a reduced immunity. So therefore, the mortality in the elderly is way higher. It reaches up to 18 to 20. You can see the sign and symptom of this virus resemble like a common cold. Though the virus can infect within 2 to 14 days, which is called the incubation period, but generally 5 to 7 days is the time the virus takes once it affects a person to manifest diseases. This is called incubation period. Most of the symptoms are like a common cold, but there are some dissimilarities, like there is a cough, but the cough doesn't accompany with nasal discharge commonly. It can, but commonly. Also, fever is very common. 99% in some studies manifest as fever. Though these are the common symptoms, but the virus can also present with loss of smell, loss of taste, and sometimes even manifest as a stroke. So more and more new things we are learning about this virus. What to do once you have these symptoms? Often people get scared. They come to the office and ask what to do, or ask for the test. Once you have symptoms similar to these symptoms, call the office. It's better to prevent others, because if you are exposed or if you have infection, there is a risk that you may transfer the infection to the others. So call the office. We will send the request slip directly to you through email or to the lab. And also, once you go to the lab, call the lab in order to schedule your visit, and we are face mask and other preventive things in order to prevent others, like face mask and gloves. So it's very important, once you have the symptoms, you prevent others to spread the disease. Also, people, once they want to know about the virus, and when we say that, okay, since you have symptoms, it's better for you to stay in isolation. At least you should not transfer infections to the others. That part is difficult. Generally people don't want to do, but this is very important, because if it turns out that you really have the disease, then all those people who you did expose might also get the infection. So once you decided that you are going for the testing, you start your isolation from that time, not once you are diagnosed and then the doctor say go in isolation. That's already too late. Person. Who are the people who are more prone for infection as well as the increased mortality? Initially, we thought it is mainly respiratory virus, but now we are learning more that the people who have underlying cardiovascular diseases are more prone for infection and mortalities. As you can see that the people who have a cardiovascular disease, their mortality rate is 10.5%. And of course, diabetes is always there because diabetes reduces the immunity, particularly in people who have uncontrolled blood sugar, and you can see the mortality rate is 7.3%. In hypertension, which is also partly cardiovascular, has a mortality of 6%, and the lung diseases have a mortality of 6.3%. Similarly, other comorbid conditions which affect the immunity and make a person weaker, like cancer, chronic kidney disease, obesity, and smoking, also have a high risk of infection and high risk of mortality. Partly this could be one of the things. Sometimes I feel like that contributing more mortality in the West, like obesity and other cardiovascular problems, and of course the elderly population are much more in the West than in the East. That could explain why there are so much more mortality in the West than in the East. It is very important to know how the virus is spread from one person to the other. In other words, we should know what is the port of entry to us. So mainly the virus affect or enter into our body through the nose, through the mouth and the eyes. Mouth and nose are the most common way of entering the body. So there is a direct spread and indirect spread. Direct spread means if the person is coughing, sneezing, or even talking, the virus hangs in the droplets and reach the person. Generally, it cannot go far more than 3 feet. Up till 6 feet is considered the safe distance. And at the same time, if the person is wearing mask, that definitely prevent the direct uh, exposure of the virus. Second way of transmitting infection is indirect. By indirect, I mean a person touch the infectious substance of any type and then touch his own mouth or nose, and so the virus get entry into the body. So in other words, the face masks prevent not from directly but also from indirectly. At the same time, it is important to know that if you touch any substance which you don't know, or you have a concern, maybe infectious, you must wash your hand. And when you wash your hand, make sure you wash your hand thoroughly. And by thoroughly, I mean apply proper soap and scrub all over hand, both sides, thoroughly for at least 20 seconds, or maybe more is better, but scrub your hand properly and then let the water clean it out. So thorough cleaning is extremely important in order to prevent the indirect spread of the virus. Now let's talk about a little bit about the mask, because we hear so much in the news what mask to use and what are the different type of masks. This mask what you are seeing here in blue stripes is a N95 mask. N95 mask means it prevents reaching the very small airborne particles to us 95% to us in through the nose or the mouth, but this requires very tight seal around the nose and the mouth. And in fact, we need to check on whether we tightly put it on the on our body, and there is a process called fit testing where you need to go there and they will put airborne particles or fumes which has some form of a smell, if you smell those particles, then it means the mask is not well tight enough. So for general use, this is difficult, and in fact the research shows that even if you use other type of mask, they are almost compatibly preventive. CDC recommend this mask which this girl is wearing, a cloth mask, because it is easy to wear, it is washable. You have to wash the mask because people don't realize that mask can also be contaminated. So if you are buying expensive mask and you don't want to wash it or to keep using it, then the mask itself cause infection. As you know that nose and mouth are the main site of entry of the infection. This is the surgical mask, which is also loose mask, and in fact it had also shown some benefit. So wear it if particularly it is easily to change, it is cheap. So if you don't have any mask, wear surgical mask so you could change it easily if you don't have time to change it after every encounter. Otherwise, face mask is what the CDC is recommending for the general people, but again, wash the mask particularly after every use or clean it. Now this become very cumbersome if one member of the family become infected with this virus. What to do, how to live if you are living in the same house or the same apartment. So we need to talk about a little bit how to prevent spreading the disease within the family members. But at the same time, we should know that we cannot cover each and every situation. So if you have such a situation, you always call the office to find out how you can handle under your specific situations. First thing you remember that isolate the person, isolate in a specific room, and give him separate or dedicated bathroom. Often this is not possible. People have bathroom to share, at least even if they afford to give one room. Then what to do if you are sharing the bathroom, then make sure the person who has infections, once he used the bathroom, he should be the one who clean the bathroom or disinfect the bathroom after he used the bathroom, particularly after wearing the gloves, and use disinfectant, which we will discuss later on. And the virus stays in the air for 3 hours, so avoid using the bathroom at least 3 hours, particularly in the air. And as I explained, all the surfaces which the person has or had touched should be disinfected before another person using the bathroom. Another aspect that is very important is the person is staying in the room and obviously in quarantine, but the person is eating, and how to dispose of the garbage. The way to do is put the waste material in a bag, and then put another bag on top of that, and put it outside the room. Do not let that person go out and put himself in the waste trolley out, because there is a chance he may touch something and that surface will be infected, and as we know that the virus stays on the surface for a long period of time. The best thing is that the person should um, the best thing is that the person put the garbage bag outside the room, and another person within the family member, after wearing the gloves, take that bag and put it in the trolley or waste trolley for pickup. And once he remove or she remove the gloves, make sure they wash the hand properly, as we discussed, scrubbing very well for at least 20 seconds. Um, and the garbage bag should not touch anything while taking to the waste trolley. This is a common question which is generally asked by the patient, that how long a substance or a surface is infectious or can harbor the infection or the virus. So the general rule is, if the substance or the surface is porous, virus doesn't stay long. But if the surface is hard, like plastic and steel, the virus stay longer. So similarly, cardboard, there is a significant reduction, tenfold reduction in 4 to 8 hours, but it is safe to use after or touch after 24 hours. Steel and plastic, there is a tenfold reduction in 12 hours, but it is safe to use in 3 days or touch it in 3 days. And as we know that aerosol, it remains in the air for 3 hours, but it also depends what type of air, because if we are talking about the stagnant air, but if the air is flowing, like if a person is isolated in a room, and in that room has a airflow going outside, then the virus doesn't stay that long. So it's always good that the air should be flowing and not stagnant, to keep the virus spreading. So now we discuss about the cleaning agents, the agent which we can use for cleaning surfaces. So fortunately, there are a variety of substances or agents that are available for cleaning. Soap, of course, can be used to wash hands and the body, and shampoo is similar to soap. But you can use bleach. Bleach is used 0.1%, don't apply directly. Just 0.1% to clean the surface, particularly solid surfaces. Alcohol over 70%. Some studies say 60%, but I would suggest over 70% use, like rubbing alcohol. Hydrogen peroxide is also can be used as a cleaning agent to clean the virus from the different surfaces, depending where you are applying. In summary, this is a good sort of a slide which somebody sent on the social media. To prevent COVID-19, don't touch man, follow woman. What it basically implies, how to remember things easily. Man implies mouth, and I for E, and N for nose. So don't touch. And follow woman means wash your hand frequently, operate from distance, meaning 6 feet. Maintain cough etiquettes. You should always wear face mask, particularly in public. CDC recommend cloth face mask. Face mask should be clean and washed regularly, at least every each use. Eat fresh fruit and vegetable, that is stand for eat, meaning you should have a good immunity, particularly if you have a other medical problem like high blood pressure and cardiovascular problem. Make sure you are very well under treatment and well controlled. Diabetes should be well controlled, or blood sugar should be normal, because these are the risk factor. And if you have any other underlying medical condition, that should be optimized in terms of care. And of course, no handshake, no body contact, because the virus indirectly reaches through the body contact. Thank you very much for viewing this short video. I hope I touch at least the common questions that are asked by the patient, and at the same time we provide care, and we are offering telemedicine, as well as you can consult through telephone. We are available 24/7. So again, if you have any concern or questions or symptom, call the office. We will be glad to help you. We will be send the request slip directly to you through email or to the lab, and whatever is needed, we will be more than happy to provide to you. I hope you like this video. Thank you.